Quick question, what color was your urine this morning? Was it yellow, orange, or totally clear like water? You might not know that something as simple as your urine could reveal whether your kidneys are failing, your liver is struggling, or you are just drinking too much water. Most people even flush without even checking on their urine to see if the urine is normal or if they see something unusual, anything strange, you don't check. But your urine might be passing message to you and you might not even know. You might ask yourself that question, that why do pee color matters? What's the big deal about urine color? Why do I have to check it? Well, listen good. Urine is not just waste. It is a report card from your kidneys and body. The color, the clarity, smell, even foam carries messages about your hydration, organs, and even deeper issues. Which is why today I will walk you through what each color means, what causes heat, the dangerous ones you should never ignore, and when to take the real action before it becomes a medical emergency. That is to say, by the time you are done with this video, you will know exactly what your pee is telling you. And the first one here is the normal urine color. Before we head over to the abnormal urine color, we should know what a normal urine color looks like, right? So, a normal urine color looks pale or light yellow. This color is a healthy signal. And you see that light yellow color is usually caused by urochrome. Urochrome is a pigment that is formed from breaking down hemoglobin. So if your urine color looks like this, it means that your hydration is on, your kidneys are featuring well, you're likely healthy and hydrated. First thing you can do for yourself is to maintain that color so that nothing goes wrong, right? Once you sip water throughout the day, it's not like waterfall on the go low. Just sip water, between throughout the day. And you can include hydrating fruits like watermelon, cucumber, just to maintain balance. And let's move over to the ones that are not normal. We have the dark yellow urine. That amber color. This can be caused by mild dehydration, excessive vitamin B complex or iron. It can also happen after exercise, sweating, or hot weather. Look at it here. When you are dehydrated, your kidney will try to help out. It does this by preserving more water. And more water preservation causes concentrated urine. It makes your urine look more conk, thereby causing that dark yellow color. So the best thing you can do here is to try as much as possible to stay hydrated at least for the next 2 hours. Drink enough water, and then throughout the day, you still continue to sip water, just to be on a balanced level. Don't overdo it though. Next, orange urine color. You can also say light brown urine color. This could be from medicines like rifampicin, vitamin B complex. It can also be a sign of severe dehydration, liver or bile duct problems. Food pigments like carrot juice, beetroot, too much vitamin A, or high dose B injection. So if you see signs like fatigue, dark stool, pale stool, or itchy skin, the liver might be involved. So what do? Pause supplements at that moment, still leave whatever medications or supplements you're taking, and then rehydrate slowly. Don't forget to check in with your doctor. When you monitor your stool, you see that your poo looks different. You cannot tell what it is. You need to check with your doctor if that color persists, like you are seeing it over and over again. Next is red or pink or bloody urine. This is a critical alert. This could be from beetroot, blackberries, or certain medicine, but it can also mean blood in urine, urinary tract infection, kidney stones, bladder or prostate issues, or worse, hematuria, that is blood in your urine, must never be ignored even if you are not in pain. If your pee looks like tomato stew without tomato, go and see your doctor. Drink water. Note any pain, fever, cramps. Just go and see your doctor if you see any kind of unusual feelings. Don't ignore persistent red urine. Get checked immediately. Next is purple color urine. This is rare though, and it's usually seen in catheterized patients. Purple urine bag syndrome, caused by certain bacterial infections. If you ever see it, it is time to visit the hospital as soon as possible. Then we have blue or green urine color. This could be from food dyes, medications like propofol, amitriptyline, Rarely, it may mean bacterial infection. This is strange but not always dangerous. Then we have cloudy or milky urine. This usually means there's an infection. It could be urinary tract infection, it could be protein in your urine, and it could also mean kidney problems. This can also tell you that there is high phosphate after a heavy meal. If it smells bad and there is a pain while you are urinating, see a doctor immediately. And the final one here is colorless or clear urine. This is where most people get it wrong. They believe that if the urine is clear, colorless, white, nothing, they believe they are healthy. But guessing it's wrong because that is not a normal urine color. It could mean that you are drinking too much water. Your urine should not be over diluted. It should not be clear. And this color can also be tricky. It can sometimes be linked to diabetes. That is when you are urinating excessively, frequently, too often. Of course, hydration is good, but don't overdo water intake. So what are the things you need to do, just to stay in check? Make sure you hydrate consistently. Drink enough water or coconut water. 2, try as much as possible to track your urine color, for 24 to 48 hours. Note your diet, note your medications just to see what influence they have in your urine. 3, reduce dyes and unnecessary supplements temporarily. 4, watch out for symptoms. Listen to your symptoms. Your body will tell you something if anything is going wrong. So it is best for you to pay attention to your body. When you notice any kind of symptoms like dark stool, pain, cramps, all those symptoms, you're sweating excessively, you're urinating excessively, get a medical care immediately. Your body will definitely try to tell you something when something is going wrong. So if you notice any kind of changes like fatigue, you're sweating at night, you're urinating frequently, you're having dark stool, all the symptoms that feel unusual, then you need to seek for medical help immediately. Then 5, create a P log, where you write the color, the smell, the clarity, and share it with your doctor if something goes wrong. Just this is what you notice though. This is what you notice when you have that log with you. Now you know that your urine is like your body's report card. You don't have to ignore any kind of signal it is giving you. And you see that urine color changes, especially those red, orange, and cloudy urine color. If they come with pain too, don't wait for any other thing. See a doctor immediately. Now tell me, what is the strangest urine color you've ever seen? Tell me in the comments. And please, if this video opened your eyes, don't keep it to yourself. Share it to your friends and family. Share it to at least 5 people you care about. Let them stay aware so that they can also watch out for their urine. Some people don't care about their urine. It might shock you that they don't. So please, let them stay aware. Like this video and subscribe to the channel for more important health information like this. And until next time, don't forget your health is always my mission. So please, don't stop striving.